Welcome to our Freedom from Suffering Now video blog. I'm Dr. Steve Grinstead. Today I want to talk about how neuropathic pain management is different than regular chronic pain management. For a lot of people who experience neuropathic pain, they really get it. I know for me, I've experienced it periodically throughout 32 years of living with chronic pain. Some of the common symptoms a lot of people that I work with exhibit are the numbing, tingling, itching, aching, stabbing, electrical-like sensations. But the numbness is probably one of the most troubling for a lot of people. The burning and deep pain in the legs is something that really impacts a lot of people with low back injuries. The pain seems to radiate or spread far from the original point of injury. There's often neurological damage that's been done. And sometimes this can be addressed medically with medical or surgical interventions. In other cases, it needs to be managed. Now, I believe it needs to be managed both medication and non-medication approaches. Some of the non-pharmacological approaches that I found effective are things like hydrotherapy, acupuncture, yoga, stretching. And some of the other issues that need to be dealt with is the psychological and emotional components of any type of chronic pain, but especially this type. When it comes to medication interventions, a lot of people mistakenly believe that opiates or some of the over-the-counter acetaminophen or ibuprofen are meant for this type of pain symptom. They're not. Traditionally, what's been used for the past decade or more are interventions such as Neurontin or gabapentin, or Lyrica, which is pregabalin, or duloxetine, which is Cymbalta. These type of medications do have good success for many people. It's working with your prescriber to find out what's best for you is what's really important. If you're watching this video blog on YouTube, go to the link below and read my remainder of this blog post about this topic. If you even want to learn more, in my book, Managing Pain and Coexisting Disorders, there's a whole section on neuropathic pain and the pain system. Knowledge is power. The more we know about our chronic pain when we're living with it, the better armed we are in order to improve our quality of life and have better outcomes. I know for me that the biggest thing is to not suffer with my pain. And I believe that freedom from suffering is absolutely possible for anybody, if you're willing to do the work. Thank you for joining me again today, and please check back frequently.